Hello friends, here is a reasoning question related to the CVS. Let's see. Peak of T wave is called vulnerable period in the heart. Explain why. So first things first. T wave means we are talking about ECG, and vulnerable period, it's about the time period, the timing. At that time, it's the vulnerable period in the heart. That's the question. Explain why. Now let's start. First thing, what is vulnerability? Vulnerability means some kind of a weakness. If it is attacked, then it will have disastrous consequences. So that's vulnerability or vulnerable period. So let's understand this in detail now. It's a little concept behind it that we must understand first. On the ECG, you know, there are 5 waves, PQRST. Now, P wave represents atrial depolarization. Let's keep it aside. QRS complex represents ventricular depolarization. So, depolarization is spreading in the ventricles. End of S wave means QRS complex has ended, means depolarization has ended. It has spread into all the fibers of the heart, of the ventricles. So S wave ends means all cells are in a depolarized state now. Ventricular depolarization has been completed. All cells are equipotential and it's a steady environment. All cells are having the same potential. They are all in a depolarized state. And then the repolarization starts with the start of T wave. T wave represents ventricular repolarization. So T wave is starting means now repolarization is starting. It will occur cell by cell by cell. So repolarization has started from the base. It is spreading towards apex in a cell by cell by cell manner. What is the meaning of peak of T wave? The peak means midpoint of T wave. Midpoint of T wave means ventricular repolarization is half complete. It means what? It means some cells are completely repolarized, some cells are partly repolarized, and some cells are still in a depolarized state. They are yet to repolarize. That's the meaning of peak of T wave, meaning that T wave is half complete, and that means ventricular repolarization is half complete or partially completed. And it means, as I mentioned, repolarization has been completed in some cells. Some cells are completely repolarized. Some cells are repolarizing now, partly repolarized, and some cells are still in a depolarized state. They are yet to repolarize. Now this is said to be a chaotic condition in the heart. Chaotic situation. Why it is called a chaotic situation in the heart? Because at this point of time, different cells are in different stages of refractoriness. Because as we saw just now that some cells completely repolarized, some cells are partly repolarized, and some cells are in a depolarized state. They are yet to repolarize. A chaotic situation in the heart. They are in different conditions of refractoriness. Some cells, their refractory period is over. Some cells are still in a refractory period. So very chaotic situation in the heart at this point of time. Normally, this is a normal situation. Now, at this point of time, if there is an electrical stimulus, means there is some after depolarization, some extra depolarization, some extra systole, which is coming from the SA node or some ectopic pacemaker, or some electrical shock, an electrical shock delivered at this point of time, at the peak of T wave, at that point of time in the heart. It can trigger chaotic rhythms. it is known to trigger chaotic rhythms. That's a possibility, and it might lead to life-threatening arrhythmias like ventricular fibrillation, and it can also lead to sudden cardiac death. So that's a possibility, and because of this, it has been called as the vulnerable period in the heart. Peak of T wave is vulnerable period in the heart, because if there is some extra electrical stimulus coming from within the heart, or some electrical shock delivered from outside, either ways, it can lead to ventricular fibrillation because of the chaotic situation present at that point of time in the heart. So that's vulnerable period in the heart. There is also one clinical vulnerable period in the heart. Now that is just an additional point. It's not related to this reasoning question, but since I use the term vulnerable period, therefore there is one more vulnerable period in the heart, and that is vulnerable period of heart failure. Now this is not related to the cardiac cycle. This is related to the heart failure. When there is acute heart failure and the patient is hospitalized. Now, in the post-hospitalization period, after the discharge, 30 to 90 days period is said to be the vulnerable period for the patient, because there are high risks of major cardiovascular events happening in that 30 to 90 period post-hospitalization, means after the discharge, or there is a requirement of re-hospitalization, or sometimes even death may occur because of sudden cardiac event. So 30 to 90 days period after the recovery from heart failure and from the discharge period, that's called as vulnerable period for heart failure patients. So that was the concept. Basically, this was just an additional point. You may not write this in the answer, but the original question, reasoning question, was vulnerable period in the heart during a cardiac cycle, and the answer was peak of T wave, because ventricular repolarization is only partly completed, and that presents as a chaotic situation in the heart, whereby if there's an extra additional stimulus, it may trigger ventricular fibrillation.